GERD, or basically reflux disease. So gastroesophageal reflux disease is a very important condition that a lot of patients suffer from. It basically means that you may have increased amount of acid exposure or refluxate coming from stomach back into your food pipe, and that is causing you a lot of symptoms. Hello everybody, I am Dr. Zubin Dev Sharma, and today I'm here with you to discuss very important and very common thing, GERD, or basically reflux disease. So gastroesophageal reflux disease is a very important condition that a lot of patients suffer from. It basically means that you may have increased amount of acid exposure or refluxate coming from stomach back into your food pipe, and that is causing you a lot of symptoms. So let's talk about step by step why GERD or reflux disease actually happens. What are the predisposing factors of somebody who's predisposed to develop GERD? What are the symptoms and that may arise because of it? What are the complications and what are the possible treatment options? So let's begin about GERD. So first of all, GERD is predominantly an increased amount of acid exposure into your food pipe coming from stomach. But at the same time, it also has a lot of component of non-acidic reflux also. It's not always about acid. There are certain predisposing factors because of which you may suffer from GERD. Now, that can be usually divided into different types. It can be a structural problem happening in the food pipe or the stomach, or it can be a lifestyle problem, and there are certain reversible factors which are identified in it. The structural problems are commonly things like a hiatus hernia, which basically means that part of the stomach has gone through the hiatus of the diaphragm into the chest, and that basically creates a pocket there from where acid goes up into your food pipe. Normally, there is a valve at the level of junction between your food pipe and the stomach, but when you have this hiatus hernia going up, then this valve function is lost, and the acid can or non-acid fluid can easily enter your food pipe. There are other structural problems too. For example, if you have undergone surgeries on your stomach and you have suffered from conditions like gastroparesis, you will definitely have increased amount of food or fluid always in your stomach, and that will keep on causing reflux into the food pipe. There are certain other factors. If you are obese, if you have a lot of tummy fat, if you have taken a lot of aerated beverages, all that will increase or predispose you to GERD. If you are not physically active, if you're not moving around, that also will increase GERD or reflux disease. Now, what are the reversible factors which can be identified? Obesity is one, I think, which we should lose our tummy fat if we want to prevent ourselves from reflux. If we smoke a lot, that's something which increases or predisposes a lot of changes in your food pipe or esophagus, which can ultimately lead to more amount of complications. Thirdly, if we take a lot of carbonated beverages like soft drinks or sodas, that also leads to more amount of reflux into your food pipe, causing more harm. Fourthly, if you do have reflux, you have to eat small, frequent meals and not just load yourself up whenever you get a chance, because that will also develop more reflux if you eat too much, too fast, and you are not chewing properly. Those are the major predisposing reversible factors. Now, what are the symptoms like? For reflux disease, we broadly divide them into an erosive type or non-erosive type. When I say erosive, that means on endoscopy, there are ulcerations in your food pipe which are endoscopically visible. And NERD or non-erosive is something where endoscopy is fine, but you still have a lot of symptoms arising because of a reflux disease. Now, when I say of symptoms, the predominant symptoms associated is the burning in your chest or burning in the upper part of your stomach. That's the commonest symptom, or what is called as a typical symptom of GERD. You may also develop burning as seen associated when you are taking food. There are certain atypical symptoms also. These atypical symptoms are something like continuous feeling of something on your throat, a foreign body sensation in your throat, continuous effort of clearing your throat, or coughing, or particularly coughing in the night. These are some of the classical atypical features of reflux disease. For these symptoms, usually patients must go to the ENT doctors or otolaryngologist and they label you as an LP or a laryngopharyngeal reflux disease. Now, what are the possible complications that may occur if you have GERD? If you leave GERD untreated, it usually develops a lot of complications. Complications like patients may have significant large ulcerations in your food pipe, which are endoscopically visible. These ulcerations may end up forming strictures or narrowings in the food pipe, which can cause difficulty in eating or difficulty in swallowing. These ulcerations subsequently, if you still further left untreated, they predispose the patient to esophageal cancers. That means a cancer of the esophagus, which can be sometimes varicose. Rarely, occasionally, these ulcerations can also bleed. You can have bleeding coming in because of these ulcerations. So, a lot of these are complications. There are certain associated diseases with GERD or reflux. It is commonly like bronchial asthma or COPD or recurrent sinusitis. And these are the common features which are associated with GERD. It may not be directly because of GERDs, but the association is definitely there. Now, how do you diagnose GERD or reflux disease? I think the first most important test would be an endoscopy. If you have a persistent symptom lasting for more than 3 months or 2 or 8 weeks, we do an endoscopy and we see whether you suffer from a GERD or not. What will we see on endoscopy? We will see ulcerations, we will see some strictures if required, we may take some biopsies from the food pipe. Plus, the most important thing, we will also try to identify if you have some structural problems which is predisposing you to develop GERD at the first place, like hiatus hernia or gastroesophageal. Now, after we have done an endoscopy, usually for non-complicated GERD, we give them a trial of acid-suppressing medications because we believe in one of the most common cause of reflux is acid. Now we give them drugs which are safe drugs like PPIs or S2RM blockers. Drugs like pantoprazole, diazepam, they work very effectively and very well. We may also give you some medicines to drink, some antacids to. Usually these are given for a very short amount of time. But unfortunately, because they are cheap and they are safer and they are easily available over the counter, people keep on taking it for years together. And then the symptoms are not because of the reflux, so it's basically independent from those drugs. After we have given you for a short duration, 4 to 6 weeks, you want to reassess it based on your symptoms also. And rarely we may need a repeated endoscopy, but usually it's purely based on the symptoms. Now, if you have a patient who has a structural anomaly or is dependent on these medications to control their symptoms, sometimes they may ask for further treatment like surgery, treatment like endoscopic therapies. For those patients, we need some additional testing. The most important test for a reflux patient, it would be an esophageal manometry, as well as a 24-hour channel acid measurement where we actually measure how much acid you are producing, whether it is definitely abnormal or not. So, with the use of this esophageal manometry or food pipe manometry and 24-hour pH recording, we divide them, we understand the mechanism of the reflux in you. We try to see do we actually truly have this reflux disease or increased amount of acid, or it is that your food pipe is more sensitive to a normal amount of acid that is coming through. And rarely we also see whether your symptoms which is occurring in you in that 24-hour window is actually occurring at the time of the acid or not, or they are totally not related. And then we label them as patients who have functional heartburn. That means the symptoms are not at all caused by acid, that is a separate phenomena. The symptoms are occurring because of the sensitivity issues. The drugs required to treat these patients are totally different. You will not give them anti-acid drugs, and certainly you will not ask them to undergo surgery for their hiatus hernia if the symptoms are not correlating with the acid production. So if as a reflux patient, you are contemplating or your doctor is contemplating any kind of surgery for you, please do not undergo surgery until you have esophageal manometry as well as a 24-hour pH UPDA study done. Surgeons should not test the patient without these tests available, except when you have a complicated reflux disease like large ulceration in the food pipe or strictures. Now, how do we manage them long term? If you have a large hiatus hernia, you will require surgery. If you do not have, you may just require drugs. So understand is that one of the most important tests for a reflux patient is endoscopy followed by manometry if required. Because manometry will not only tell me your in the structure. It will also tell me whether your food pipe is functioning enough or not, what is the physiology of it, whether it is having the power to push the food down or not. But we don't want that you do a surgery and then you start having difficulty in eating food. It is not uncommon. So reflux is a manageable illness. As a doctor, it's my job and it's your doctor's job to identify why a reflux is happening in you. And once you have identified that factor, that has to be managed. One small point about H. pylori infection. H. pylori infection alone will not cause reflux. In fact, in some data, it actually is protective for a reflux disease. You should not be labeling somebody as reflux and then try to treat the H. pylori. That's not the same thing. So if you have any more doubts of reflux disease or GERD, please feel free to message us. We'll definitely reply back and tell you how to take the point. Thank you, sir. How to connect to us? I think it's not very difficult. The number is given. On this number, you can message us, WhatsApp us. A message will come back to you on how to take appointments. Appointments can be a physical appointment or an online appointment. A physical appointment is available at Fortis Memorial Hospital in Gurgaon in Haryana. And for online, there is an app which will be given in the message itself. You can also try to connect to this number. You can call this number. The coordinator will pick it up and guide you if you have any problems in trying to take appointments. So please feel free to message us. And the appointment is not difficult. As soon as you WhatsApp us, you will get a message for it. It may be some delay because there will be a lot of work going on, but you will definitely get a message. So thank you so much.